Hello there. I'm Dr. Yeleti, Chief Physician Executive at Community Health Network. I want to give a brief update today on what's been going on with the pandemic, as there's been a lot of changes probably just in the past couple of weeks or so. In particular, there's a few key facts I think people need to be understanding and be aware of, especially because of the Delta variant that's coming along. What's different today than early summer is that we have a very contagious, as a matter of fact, the most contagious variant of this entire pandemic. The Delta variant is so contagious, it's probably several times more contagious than what we've seen before, and because of that, we're seeing the end results of that. Here at Community Health Network, in the past month, the number of people hospitalized has doubled. The number of employees out due to the coronavirus has also doubled. We're also learning is that the amount of virus in the nose from the Delta variant can be 1,000 times more than people that did not have the Delta variant. And because of that, we understand that even wearing masks may not be sufficient. That masks are reasonable, but we understand that even wearing a regular mask and PPE or personal protective equipment helps, but because it's so contagious, we still need to be extra cautious. The message out there is that the vaccine is the best protection we have. It used to be that if you wore a mask, that you were equally protected as much as a vaccine. Unfortunately, with the Delta variant, it's so contagious that it's much better to be vaccinated and rather than just having a face mask or other protection from it. So I do support the CDC guidelines, which they had to change because of the variant, where it's saying even vaccinated, you should be wearing a mask indoors. It's very important to understand that with the variant coming, even if you're vaccinated, you now can potentially get the coronavirus. You're not going to get hospitalized or die from it. There's more likelihood today than there was a few months ago that even vaccinated, you can actually get the infection. And the issue with that is then you could then, even vaccinated, if you get the infection, you give it to somebody else. So we're seeing transmission from people that are vaccinated, which was not the case in the early summer. So just a word of caution is that things have changed, and the biggest change is the Delta variant and how contagious it is. So just want to be aware that we want to keep our guard up, even vaccinated, using masks, being careful when you're indoors, and social distance. And for those that are not vaccinated, the level of difference between vaccinated and not vaccinated is huge. And so I would strongly encourage you at this point, because unfortunately we are seeing another surge. We're well into our fourth surge, and it's only going to get worse for the next couple of months before it gets better. So if you're not vaccinated, talk to your healthcare provider about the pros and cons of being vaccinated. If you are vaccinated, you may need to keep your guard up a little bit more, especially if you're around vulnerable people or if you're indoors. Thank you very much for all that you've been doing. I know we're getting very tired of the pandemic. We will get through this next surge hand in hand together. Thank you.